My name's Anne Black. I'm Regional Quality Assurance Specialist Pharmacist for the North East and North Cumbria. I'm delighted that we've been successful in this region in securing some monies to manufacture injectable medicines. It's great news for our clinical colleagues, nurses and other healthcare professionals who at the moment have to make a lot of injectable medicines on the wards. They will have more time to be able to care for patients directly. It's great news for patients themselves. We're going to have consistently high quality products which they can be in receipt of, and it's great news for the region. We're going to have a skilled workforce and an academy to create a pipeline to make sure that this is a very resilient service as we move forward in the NHS.
Ken Rebner, Chief Executive at South Tyneside and Sunderland NHS Foundation Trust, but also the Chair of the North East and North Cumbria Provider Collaborative. This development is important for the North East because it's the first time all the hospitals within the North East have collaborated together on a particular project of this scale and size. And there are three particular reasons why I think it's important. Firstly, many of our existing aseptic units around the hospitals in the region are already working pretty much at full capacity, and clearly all are looking ahead about some of the future demands we can see and the need for more access to more complex drug regimes in the future. So we need to be preparing for that eventuality now. And this joint development between us all, the collaborative of hospitals in the North East working together, is going to give us some certainty over that supply and capacity, hopefully for the next 20 years or so. So we've very much got one eye on the future and making sure we have got the capacity for some quite complex and specialist chemotherapy drugs in particular, and to make sure that's there for when patients need it in coming years.